A beautiful day mga ka-CSA. Welcome to the Certified Skin Authority. I'm Dr. Contessa, your host, giving you updates on the science of skincare, anti-aging medicine, laser technology, and aesthetic dermatology. One of the key attraction points of our face is the nose. So, isa sa nagbibigay ng atraksyon ang ating mga ilong. Tayong mga Pinoy, we are known for having short, flat noses. Ano ba ang ideal shape ng ilong? So ano po ang madalas na pinapangarap ng marami sa atin na hugis o shape ng ilong? Sa episode na ito, meron tayong makakasamang female guest. Isa sa request niya ang nose augmentation. So paano po natin maipapalabas ang ganda ng ilong para po lalong attractive ang ating mukha. And ang title ng ating episode sa araw na ito, Your Dream Nose. Abangan niyo po yan dito lang sa CSA Certified Skin Authority.
Ako po si Jovelyn Baluyot, isa po akong writer sa isang national broadcasting company. Nakilala ko si Doc mga siguro 5 years ago na. So, initially yung mga services na in-avail ko sa kanya is yung sa facial treatment and all. Then, recently lang, just this year, yung sa V-lift naman. Yung, kasi di ba yung parang formation ng face para talaga maganda ka is dapat letter V yung face mo. So, in just like mga 20 minutes lang, nag-V na talaga yung face ko. Napakabilis lang talaga. Then, yung isang concern ko naman ngayon is yung sa nose ko nga. Kasi nga, medyo flat siya and parang ma-increase na rin yung confidence ko. So, nakita ko nga dito, she has this campaign na Dream Nose Campaign. So, it's non-surgical, so you don't have to worry baka magkaroon ng mga any blood or mga knives. Medyo afraid ako doon, takot ako doon. So, tinanong ko siya, I consulted her na mabilis lang siya, just like mga 30 minutes, half an hour lang, magagawa na siya without any surgical procedure. I'm really excited about this drip nose and I'm confident na magagawa ni Doc ito.
And we're back mga ka-CSA, ating pinag-uusapan, Your Dream Nose. Kasama natin ngayon, Miss Jovelyn Baluyot.
Hi po.
Welcome back, Miss Jovelyn.
Thank you po.
Kamusta?
Okay naman po.
Okay naman. Yan. A while ago, you were sharing with us, yun nga, regarding this, my dream nose, your dream nose, diba? Our dream nose, mga ka-CSA. And na-mention ko rin po, ano ba yung mga different kinds or shapes ng mga noses that we normally see. So, Filipino or Asian, short nose, flat nose. So, ang bridge area, parang mababa. Medyo mababa. Yan. And also the tip ng nose, yung iba wider, broader. Tapos pag nag-smile, nagiging wider lalo. Yan. Pero ano ba yung mga most dream nose talaga ng mga televiewers or ng ating mga co-Filipinos?
Feeling ko yung pinpointed talaga. Parang inverted 7. Na kapag anytime na kapag syempre, selfie capital of the world ng Pilipinas. Parang any angle, talagang maganda tignan.
Right. Yan yung nakikita natin sa mga celebrities. If you notice, elevated yung angle dito.
Yung bridge.
Yes, sinabi mo nga, pinpoint dito sa may tip area. Okay? Ideally, longer. Tapos, yung dito, yung dorsum, straighter, elevated. Tapos, sa may tip, tapered. Parang inverted 7. Yun. May iba kasi, meron yung, kung narinig mo na yung saddle type of nose, yung tip nila, parang sumobrang pointed naman, tapos wide yung sides ng nose nila. Yung iba naman, meron naman yung sumobra. So, mostly yung mga Caucasians, mga whites, sila naman may iba sobrang elevated. You've seen that, right? Meron yung dito, yung hump nila dito, sumobrang
Pag ganun.
taas, yan. We call it dorsal hump. Parang meron silang, yun nga, as the term implies, it's a hump on the nose. Iba naman yung tip nila, sumobrang taas din. And I've seen others yung hook downwards. Meron silang bridge, pero yung tip, downward naman. Pointed downwards, or parang inward, lowered. Parang dito naman lowered ng konti. Dito elevated. Diba? Sa ating guest right now, Miss Joelyn, typical Pinay. Originally, Pinay talaga, di ba? Both parents.
Apo.
Filipino talaga ang pinagmulan. So, yung dito natin, this is the radix or yung nasofrontal angle. Normally, when we do a picture taking, pag naka-side, we wanted it to be a little bit higher. Yan. Tapos, medyo short tayo dito talaga. So, we may wanna lengthen a bit ang ating nose. Ayan. So, meron naman tayong pamamaraan ngayon na pwedeng gawin for nose augmentation. And of course, it's very safe. And still, makikita mo yung ideal shape ng nose that you want. Marami akong mga clients ngayon, Miss Joelyn, inquiring about this non-surgical nose lifting. So, before, we had featured already yung non-surgical nose lifting with the dermal filler or nose filler. And we also had using the hyco cannula threads. Yung sa aking dermal filler before, it was using mga sharp needles. But right now, we'll be using a different technique, the cannula technique. So, ipapakita natin yan sa ating mga televiewers. Do you have any questions, Ms. Joelyn?
Gaano po siya katagal, yung procedure po mismo?
Right. Ito yung mga treatments. Actually, we call it lunchtime treatment or coffee break treatment. Actually, half an hour, okay na eh. Yung topical anesthesia, we apply a cream na pampamanhead. Normally, I have it like 45 minutes to an hour. So, yun lang yun, yung pampamanhid dito sa balat, sa portion na to. And then, when we do the procedure, mabilis lang siya. 15 minutes, 20 minutes, enhance na ang nose. So, even during your break time, you can do it. Any other question, Ms. Joelyn?
Gaano naman po siya katagal naglalast?
Okay, may mga studies done on dermal fillers. If we use the Restylane Perlane, they have said that it may actually last 36 months, but with 1 or 2 retreatments. Meaning to say, like after a year, pwede kang mag-add, magpa-inject ulit. So, parang booster. So, after 12 months or after 24 months, you may re-inject again. And it's mainam kasi non-surgical. So, walang mahabang recovery period. No knife, no cutting, no incisions, no sutures, no scars. Right? Some of my clients kasi takot na takot sa surgery. Takot sa mga cuts, takot sa knife, meron pang general anesthesia. So, ito yung mga procedures na pwedeng-pwede sa kanila. Minsan nga, meron akong tinitreatment, injection lang nga, napapaiyak na. So, meron po mga tao talaga na scared of surgery. So, if they want to enhance or augment their nose, ito po yung maaaring procedure for them. I think Miss Joelyn is not really scared about this.
Yes, I'm really excited about it. And
Right.
sinabi nga, syempre kinabukasan may work na kagad. So,
Yes.
and we want to look it parang natural lang talaga.
Natural lang, exactly. Because I've been seeing a lot of people who have done surgery or the surgical rhinoplasty. Some of them, okay, it's balanced to the face, may harmony sa face. But some others I have seen na hindi sila happy dun sa naging outcome. So if they're not happy about it, they can do a revision rhinoplasty. I've seen one, well, I'm so sorry to mention, hindi talaga siya naging happy. Parang ang term na tinawag niya sa itsura niya, yung mga avatar, parang nag-avatar. That's why I recommend to most of our televiewers, if they want to do surgical rhinoplasty, first-timers, okay, kung gusto nila i-try muna ang non-surgical for you to see kung babagay or para malaman mo kung ano yung ideal shape, di ba? So, mas mainam mag non-surgical muna tayo. Now, the one that we will do for Miss Joelyn is called a medical rhinoplasty. It's just an injection of a product. We're going to use Restylane Perlane for Miss Joelyn. So, ating ipapakita sa aming mga, or sa ating manonood sa mga ka-CSA ang actual procedure ng non-surgical nose lifting using Restylane Perlane sa pagbabalik ng CSA Certified Skin Authority. And we're back mga ka-CSA. We are now on the part of the actual procedure of the non-surgical nose lifting using the Restylane Perlane via cannula technique. So, we also do a so-called picture taking or nose mapping para po ma-determine natin kung ano yung area that we should work on. So, for Miss Joelyn, we need to augment the nasofrontal angle here. How are you feeling, Miss Joelyn? Excited. Pero prior to this, we actually had already placed a numbing cream. We left about an hour ago, right? And Miss Joelyn has work tomorrow, so hindi siya pwede dun sa mahabang downtime. So, very safe naman to, Miss Joelyn. Okay, studies were done. And we have the Restylane Perlane that we're gonna use for you. Now, Restylane is the market leader when it comes to dermal fillers, hyaluronic fillers. Okay. Have you heard of this, Miss Joelyn?
Opo.
Yes, okay. Narinig na niya. International product ito. So, you look at the manufacturing date as well as the expiry date. So, we tell our patients ito yung expiry date niya, year 2018 pa. And we normally give this, the label of the product to our client every after procedure. Para alam po ninyo kung ano yung product na na-inject sa ating nose area. So, we'll open this box of Restylane Perlane. Tingnan naman ang safety parameters, standard, so maintained, tampered proof, yung nakaseal talaga siya, ayan. So, ito po yung gel that we will be injecting into your nose area, particularly sa may bridge part po. So, kami po, mga ka-CSA, before we do any procedures, we do muna physical assessment. Inaalam natin ang iyong medical history kasi baka naman may contraindications. Normally, I have patients na tinatanong ko, oh, are you taking some warfarin, Coumadin, mga blood thinners? So, kung merong mga nagtitake ng ganon, we request that they consult muna yung kanilang attending physician and get a clearance kung pwedeng i-stop muna yung mga ganong medications. Right? So, napaka-safe po ng bawat client namin dito sa CSA. Talagang sinusunod natin yung mga safety parameters. So, this is the injector. This is the syringe. Okay? So, meron siyang lower lock system. And I've mentioned a while ago, we'll be using a cannula. Okay? Hindi po tayo sharp needle. So, blunt ang tip ng cannula. So, less of a trauma to the structure inside. Okay? So, with Joelyn, we'll be augmenting yung nose bridge mo. And we'll also augment your tip. Okay? So, elevate natin. And ang desire ni Miss Joelyn, wag naman daw po yung sobrang mataas. Wag naman yung masyadong mabibigla. Wag naman yung baka pagpasok bukas, ma-conscious siya sa work, hindi makapagtrabaho ng mabuti.
Opo, Doc, after po ng procedure, may mga dapat po bang inumin ng mga gamot?
Yeah. After the treatment, I prescribe mga pain relievers kung kailangan lang and some prophylaxis na antibiotics. Yun lang. And then I tell my patients do ice compress dun sa area na we knocked on natin. And I tell them to avoid mga extremes of heat, sun exposure, o kaya wag mo nang mag-hot sauna, o yung mga hot steam, yun lang. But then you can go back to your usual work, usual activities. And also, no heavy or very strenuous exercises muna. Yan, just for a week. And then you'll come back for a follow-up, normally 1 week or 2 weeks follow-up po. para ma-check natin kung yun yung natatawag na checking balance. Kung proportionate siya, kung okay na yung elevation, if we still need to augment a little bit. Yan. So, we have this cannula technique po, and it has a sticker on the bottom part. So, meron siyang mga lot numbers dito. Yan. Serial numbers. So, we place that on your record on your chart. Ayan. Now, we still have to numb yung tip ng ilong. We make use of a tiny, itsy-bitsy injection lang po. Okay? Para talagang totally numb. So, close eyes lang, Miss Joeline. So, this is just a tiny shot para lalong manhid yung kanyang skin. Okay? Yan po. So, we touch the tip. Okay. Take a deep breath. Inhale, exhale lang, Miss Joeline. So, sa tip lang po, just a 0.1 ml. Inhale, exhale. Good job. And inserting the lidocaine. Ito kasi yung area na lalagyan natin ng entry point. There. There you go. So, we're done with the lidocaine injection. Now, we only have a point of entry. Lalagyan lang po namin ng area na kung saan natin ipapasok yung cannula. So, normally, dito lang po sa may center na to. Just a bit. Okay, you feel that? Manhid na siya, Joeline. So, it's totally numb. We just have a point of entry here. So, this is the cannula for our Restylane. Okay. Just the entry point here, we insert the cannula. Yan po. And then, pinch ko yung tip ng nose niya. Normally, numb naman yung sa tip ng nose, hindi nararamdaman. Yung pagpasok ng cannula, na sense mong may pumapasok but it's not painful actually. So, we wanted the cannula to enter the full nose length. For some of my patients, short ang nose. So, we need to maneuver pa. So, it's very important to reach the radix part. So, we normally stay lang dun sa dorsum ng ilong. Ayun. So, I have my cannula inserted na hanggang dito sa my radix. Dito sa angle, in between the eye area. Nasa pagitan na po ng medial canthus ng both eyes. And gradually, I push the product. Gradually or slowly, I inject a filler. Dito na po siya sa may radix or nasofrontal angle. So, the gel is viscous. So, pag ini-inject po, it's a bit, you have to exert an effort in injecting it because we have a viscous gel. So, while injecting a bit po, nananotice na naglalaman na yung bridge ng nose. Kay Joeline kasi we have to augment talaga yung nasofrontal angle or the radix. Even yung tinatawag na rhinyon. Dito sa may body ng nose. So, it's just staying on the center, on the dorsum. Dito lang sa gitna. Sa taas. So, ang ating syringe has 1 ml na hyaluronic gel. So, we will be using the full 1 ml syringe for Miss Joeline. So, actually, naglalaman na yung kanyang bridge. And sa bridge pa lang, we are already injecting 0.5 ml. Ito po yung volume ng filler gel na ating ini-inject. You can actually make use even like 2 syringes sa isang patient. So, nalalamnan na po, umaangat na po. And I'm slowly pulling the cannula palabas. So, may resistance na. So, I have already injected about 0.5 ng Restylane Perlane Hyaluronic Gel. Okay. How are you feeling?
Okay naman po, Doc. Medyo
Okay
napipil
lang.
ko na umaangat siya.
Yes. There's a sensation na nagli-lift yung nose bridge. Although for Joeline, ayaw niya nung bigla. So, we'll make it moderate for her and balance sa kanyang face contour. There should be harmony ng nose shape to the shape of the face. Ayan. Actually, nag-lift na siya. Later, I will be showing to Joeline kung happy na siya sa ganitong taas. Kasi we still have the option to add more. Kasi naka 1 entry pa lang ako. Right now, what I will be doing is to fill in yung dito sa columella. We call this, yung gitna po, columella. So, I need another entry point. So, ang ating gauge 23 needle, it serves as an injection point. So, we can just insert dito. Okay. So, some of my patients talaga, merong tendency na one injection only, you see some bleeding. But that is temporary, it will stop. So, Joeline is still okay. We can still add dito sa columella. So, I already have my entry point. Dito, entry point sa taas. And then, going po sa kanyang columella para ma-augment din yung kanyang tip. Filipina race po si Miss Joeline. So, ang mga Filipina, magaganda. Naturally beautiful. So, I'll be injecting 0.3 ml ng ating filler Perlane dun sa area. So, para rin yung tip niya ma-augment, ma-shape. You okay, Jolene? So, she's okay actually. So, this is very good dun sa mga patients na takot talaga sa mga major procedures, surgical procedures, na meron silang mga phobia sa mga cutting, incision, surgical knife, yan. So, magandang alternative po ito. And for those who wanted to do surgery, kung gusto mo muna nilang makita kung babagay, they can do this kind of procedure. Minimal amount lang para hindi po mabigla ang ating looks na natural pa rin, that they could still recognize Joeline. So, I still have a 0.15 ml. So, we can use that for the tip na po. Actually, I can still augment. I can still add more. I can still use one more syringe. But I'll give the decision to Miss Joeline kung tama na yung shape that we have done for her. This is just augmenting again. Nose shaping, nose definition. Okay po. Joeline is always busy. Marami rin siyang nire-rush na reports. So, we have used the 1 ml Perlane, Restylane Perlane. This one has a 20 mg per ml of hyaluronic component. And it's pre-filled with lidocaine. Yung pong mga fillers natin ngayon, they already have lidocaine in them para po walang kasakit-sakit No pain, mga ka-CSA. O, ayan. We're done with the nose augmentation for Miss Joeline. So, mga ka-CSA, wag po silang maglilipat ng channel. We'll be back. So we're now on the finished product of our non-surgical nose lifting using the Restylane Perlane via cannula technique. Okay, Miss Joeline, ayan na po ang ating finished procedure.
Wow.
So what do you say, Miss Joeline?
Ang galing, ang bilis lang, tapos
Right.
ang bilis ng result.
Ang bilis ng
Tapos wala
result.
siyang mga bleeding and all. Ang galing!
Yes.
Thank you, Doc.
Wow. So this is exactly the Your Dream Nose project of our CSA. So sa episode na ito na amin pong ipinakita, ito ay yung pag-lift ng nose the non-surgical way, a medical way, or the so-called medical rhinoplasty. And of course, our Miss Joeline is very happy. Yung tama lang po na height na gusto po niyang i-achieve, hindi po yung mabibigla yung mga kasamahan niya sa trabaho, 'di ba? Yung may nagbago, pero sometimes they cannot pinpoint what did you do. Para lang naka-nose line si Miss
And it's very
Joeline.
natural. Hindi
Very
talaga
natural.
mapapansin.
Exactly. Looking at her side right now kasi yung nasofrontal angle has elevated. Moderate po. So that is the desire of our client right now. Because most of my patients also ayaw nila yung sobrang taas, yung sobrang obvious. Gusto nila minimal or just the natural way lang po. Na still, it's gonna be you. So this is your dream nose, my dream nose, our dream nose. Oh, yan. So very happy, Miss Joeline. What is your message to our televiewers?
So sa mga gusto magpa-nose lift and ayaw talaga ng mahabang downtime, just go here sa CSA located at
Right.
Pangalacan City. And in
Yes.
just 15 minutes, makukuha mo talaga, ma-achieve mo yung dream nose mo.
Yan, 15 minutos nga lang and instant lifting na po. So tomorrow, happy tayo
Yes.
to go to our work. At hindi naman masyadong mako-conscious, no?
Mm-mm.
Meron kang pinagawa. Our clinic is located here at the second floor, Pure Gold Dau Building, Dau MacArthur Highway, Mabalacat City, Pampanga. Ang aming mga contact numbers 045-331-1117, 0925-704-9908, and 0939-393-9643. Kami po'y bukas from Mondays to Sundays, mostly 10 a.m. to 7 p.m. So kayong mga nagbabalak ng Dream Nose project na ganito, maaari nyo na po kaming kontakin. Kung nais nyo muna pong mag-inquire, you may also email me at csaskinclinic@yahoo.com. Meron din kaming FB page, csadermcentre.org, or Instagram, doc_contessa, ang ating website, csadermcentre.org. So mga ka-CSA, maraming salamat po sa patuloy niyong pagtangkilik ng aming mga episodes. Inaanyayahan ko rin ang aking mga co-doctors. We have a convention in September 11 and 12. The Philippine Academy of Aesthetic Surgery, ang topic, to cut or not to cut. And October 14 and 15 by the PAPSP, Philippine Association of Primary Skin Health Physicians Incorporated. Speaker din pala ako doon. The topic, Global Innovations in Skin Health. So, maraming mga updates, marami pong mga innovations all over the world na amin pa rin ipapakita o ibabahagi sa inyo mga ka-CSA. Maraming salamat sa aking mga sponsors, Restylane Philippines, Galderma Philippines Incorporated, Menarini Philippines Incorporated, Allergan USA, and also Skin Medicine Incorporated. Maraming salamat sa aking CSA family, CSA staff, Sir Bot for my hair and makeup. Also, Miss Joeline, thank you very much sa inyong lahat, mga ka-CSA. Maraming salamat. Ako po muli, Dr. Contessa Salvador. So when it comes to your skincare, you can trust the CSA Certified Skin Authority.